Did you know that people with the diabetes have very high risk for multiple infections due to various reasons? And vaccinations are one of the most effective and underused tool by the diabetics. Welcome to this video. My name is Dr. Kulmeet Kundlas and I've been primary care physician for the last 27 years. Today we'll be discussing very important topic about immunizations in diabetics. Why this is important? Because diabetics have poor circulation. Their blood cells, which guide and protect our immune system, they are underworking. Our antibody response is not as robust and they are not as effective. And whole host of complications happen due to different cytokines in diabetes because it is a inflammatory disease. So if you want to know all about diabetes and diabetic related vaccines, this is the best video for you. Why we need vaccines? Prevention is more important than active cure. As we all know, once we protect certain things, we do not have to suffer consequences. The same way is vaccines. Diabetics, as I mentioned above, have poor circulation invariably. They have poor nerves endings and neuropathies most of the time. Their defense system is not working properly, which is through different cells, and antibodies are not very effective. That makes them high risk for complications, including local at different parts of the body, skin, different organ systems, and systemic infections, leading to sepsis and death. So that's why this video is dedicated to all diabetics so that they should go and get the 7 essential vaccinations. Number 1 is flu shot. Flu shot is indicated for all diabetic once a year. There is a lot of confusion and a lot of myths among diabetics and general population regarding the efficacy of flu shot. Flu shots prevent death, they prevent chronic complications. You should get flu shot every year. Number 2 is pneumonia shot. Pneumonia shot has a lot of confusion. It comes in multiple different variations. The most common variation which we use or the vaccine we use is Pneumovax. Pneumovax is indicated twice in your lifetime. If you are less than 65, you need to have one shot. And once you become 65 and above, you need a second shot. PVR and other vaccine schedules are more complicated, but if you take this shot, you will be about 90 to 95% protective. And as you know, the goal of my channel is to simplify healthcare information and not confuse you with the complex medical jargon. Third vaccine, which is utmost important, is Tdap that covers you for 3 infections, tetanus and pertussis and diphtheria. These vaccines are indicated every 10 years, and we, as a diabetic, have a lot of risk to develop these complications, and you must take these vaccines. Number 4 on the list is shingles vaccine. If you are above the age of 50, you must get Shingrix vaccine. It is 2 shots, 6 months apart, above the age of 50. The most dreaded complications of shingles, in addition to local complications, is post-herpetic neuralgia. As a diabetic, you are high risk to develop painful neuropathy, and that will complicate the issue. Next vaccine is RSV. RSV is indicated in diabetics and in general public. Anybody who's above the age of 60, it's a one shot, one time in life. RSV goes unnoticed. It starts as common cold, but as you are diabetic, you are very high risk of developing complications, and you must do everything to protect yourself from this deadly disease. Next, the most controversial one is COVID-19 vaccine. You must keep yourself current on COVID vaccine. I know we as a healthcare industry has not done a very good job convincing you and giving you the proper information, and this is one of my attempt to simplify that you must take it. Contrary to anything you might have heard, COVID vaccine prevents you from getting initial attack of COVID. If God forbid you get it, it definitely prevents hospitalization and death. And it is about 90 to 95% effective. We should wait and continue to process our latest guidelines, and you must consider yourself taking COVID vaccine as and when the new guidelines come in. And we, as a medical industry, have done a very good job at least sending you the information and convincing you why you should get vaccinated. I think I have made enough case that because of a decrease or poor immune system every diabetic have, contrary to how controlled your diabetes. I am making a case that you must get flu shot, pneumonia shot, Tdap shot, and then Shingles for the shingles, RSV, and COVID-19. If you take it, you will prevent a lot of unnecessary complications and you will have a happy and prosperous life. I have listed another 15 commonly asked questions about the vaccination in diabetes, and I answer all your questions. Thank you very much. I will see you in next video.